Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Zoe Rothblatt, Associate Director of Community Outreach at the Global Healthy Living Foundation.
And I'm Corey Greenblatt, Associate Director of Policy and Advocacy at GHLF.
Our goal is to help you understand what's happening in the healthcare world, to help you make informed decisions, to live your best life. And just like you heard, I'm joined by Corey Greenblatt today to co-host and update us on all things advocacy and policy for 2024. So Corey, welcome back to the Health Advocates.
Thank you so much for having me, Zoe. Excited to talk to you and excited to talk about some state policy stuff going on this year.
Me too. I feel like you're our unofficial, official fill-in co-host, so we appreciate you coming on.
I tell Steven all the time, I'm always happy to pinch it. It's my pleasure.
Awesome. Well, before we get into everything that you have to share with me and our listeners today, I just wanted to quickly talk about these quick poll results. So we often share here the results of these quick polls, which are sent to our patient support program, and they're on a variety of topics. This time it was about, for people living with psoriasis, about how satisfied they are with their treatment. And as I'm sure you know, Corey, there's a bunch of different types of treatments for psoriasis. You could do things like topicals or take more like systemic medication that's a pill or injection. So we wanted to know what was people's experience with those and how do they feel about them. So are you ready to hear?
Yeah, let's hear what they had to say.
So for the people that were currently taking a topical cream, such as a corticosteroid, to treat their psoriasis, about half said that they were. And what was really interesting was that 55% were neutral or disagreed that they were satisfied with that topical's ability to prevent or treat their condition. So that means like over half aren't really feeling like it's doing a great job.
That's a lot higher than it should be, if we're being completely honest.
But then some good news as the poll went on. We asked about a systemic medication, such as a pill, injection, or infusion to treat psoriasis, and 65% said they're taking one. And then when asked the same question about if they're satisfied with their medication's ability to prevent or treat the condition, 74% agreed or strongly agreed with that. So what this just told me was that if you're not feeling satisfied with your treatment, talk to your doctor about it. There's probably more options that you can try. Maybe something in this scenario, like a systemic medication, is working on the whole body versus a topical just in the area you put it. So it just told me the importance of advocating for yourself and bringing up these concerns with your doctor.
Yeah, and I think one of the really great things this shows is for many things, many conditions, as you said, there are options. You're not locked into a single option or treatment. And the more you communicate with your doctors, the more you have an open dialogue with your team to really kind of express what you like about your treatment, what you don't like about your treatment, what you're finding beneficial, what's not beneficial, the more likely you can actually move to something that will impact you in a positive way and that you will see a benefit from.
Definitely. I really couldn't agree more. And while we're here, I can't not plug it. As you know, we have a webinar coming up next week, Monday, January 29 at 4 p.m. Eastern Time. This is part of our Heroes program. We did an episode about Heroes maybe last season. We could stick it in the show notes along with the registration. But this is a webinar that brings together a bunch of stakeholders, a dermatologist, a patient, a hairstylist, a psychologist. And we're really just talking a lot about exactly what you and I were just talking about, managing your psoriasis in everyday life and at the doctor's office, and how you could bring together all these people to feel your best.
Yeah, I really recommend that everyone checks the link in the episode description, registers, and does whatever they can to take part in this webinar.
Great. So 1 month into 2024, tell us what's on the horizon for this year for our 50-state network.
Yeah, this is going to be an interesting year from advocacy perspective. So in 2024, we are once again in a presidential election year. That has a lot of implications for state government. State governments are on different sessions from the federal government. We talk about this often. States governments have their own session length. So you can look at a state that has 4 weeks of a session, like Oregon, where you need to really get your ducks in a row as quickly as possible because they're trying to get the work done as fast as possible. Or you look at a state like Massachusetts, which they're in business all year long. They're open the entire year, which gives us a long time to work on stuff, but also means that there's a lot of dead time in between. So there are positives and negatives to both, but the good thing is that we have an opportunity to do some great work across the entire country in a number of different areas, and really excited to possibly do that.
So tell us about those areas. What are some of the target states or target issues that we're looking at?
Yeah. So I've been here a couple times and gone over the issues, so I won't dive into all of the issues as much. You can check out kind of previous updates and previous episodes we've done to break down things like copay accumulator adjusters and step therapy. But generally speaking, a lot of what we are doing this year still revolves around access issues. So things like step therapy. Primarily this year, there are going to be efforts in New Jersey and Michigan, and we're really excited. We think that there's a chance to really do some great work there. But the big kind of policy this year, the thing we're seeing in many states, is going to once again be copay accumulator adjusters. And this is something we've discussed at length in a number of different podcasts. It's something that we have seen success at the state level through the last couple of years, but we're continuing to start to really see some progress and getting more states covered under these laws. So before I go into my kind of Howard Dean-like listing of the states, which is a nice 90s political reference for anyone who's listening, the other issue area that I wanted to kind of bring up briefly is something called Prescription Drug Affordability Boards, or PDAB for short. And these are efforts by state governments to study certain drugs and evaluate them on a cost effectiveness basis to see if the state government can do something similar to what the federal government is doing with drug price negotiation, and try to find a way to make medications more affordable at the state level for state employees, state government employees, health plans that are regulated by the state government. But so the thing we are seeing with regards to prescription drug affordability boards, or PDABs for short, is that these are chances for patients to be able to share their experience with the state government review boards on what it's like taking certain medications. So we had a chance last year to do this with some patients in Colorado, and we're able to get them to share their experience taking things like Enbrel, Stelara, and really got the ability to share with state regulators what it was like from a patient perspective to take these medications, to rely on these medications, utilize their copay assistance programs, and everything all in between there. And it was very valuable, and we're excited to kind of get into it more so this year with more states.
And when patients share their stories to talk about how important this medication is, does that sort of then tell the PDABs to say, this is an important medication, we have to lower the price? Like, how is it all connected there?
It's a really interesting question. So they're not looking to kind of say, this is really important, let's make it as cheap as possible, because it has to come into a bit of a give and take. Say you're going to lower the price to $1, so this medication is cheap for everyone in the state. Well, the manufacturer might say, I'm not going to sell it to patients in that state anymore because I can't profitably make any money on that because you're making me lose a significant amount of money. Now, we should not make healthcare decisions based solely on cost, and we should hold pharmaceutical companies and insurance companies to that same standard. That being said, that is not always the case. And so we have to ensure that there is a bit of a give and take. These companies are producing life-saving medications, so we want them to continue to exist, continue to innovate, and continue to produce these medications. And we want them to be able to continue to give them to patients across the entire country. However, they're still very expensive. So states are trying to figure out where that middle ground is for that line of what they can regulate. And that's what these PDABs are trying to do. They're trying to see what value they can kind of determine these drugs have on the patient's lives. And if increasing or decreasing the threshold with which these pharmaceutical companies can charge will impact that value, they may try to do that. Or they might set non-price thresholds on things. They're really just trying to get a better understanding of what these drugs impact patients on a day-to-day basis do, and what the financial aspect plays into that.
And this is an interesting one for patients to get involved in, because really all you have to do is talk about how it improved your quality of life for something like maybe step therapy. I know we always say you don't have to necessarily experience step therapy. You could also tell your story, but there's not like you had to experience something negative in order to advocate for this. You really could just talk about how much a medication has helped you, which I think allows like an avenue for more patients to get involved in advocacy.
I couldn't agree more. I think it's a unique opportunity for advocacy with regards to these kind of prescription drug affordability boards, because as you said, they just want to hear from patients. They don't care if it's positive, negative, anything in between. They just want to hear what it was like for you to take these medications. And it doesn't matter if you are currently on the medication, if you previously took it and had to switch off of it. All of those things are very important. So when we start to get into the states that are starting to look at these things, if you're in one of these states, really keep in mind that this isn't just something where you maybe have to go to a state house and spend all day in an advocacy day. This is something that by and large is virtual. Many of them take place at local times, so you can be at the non-work hours, so you can kind of take this from your home computer, share your story, and it cuts out a lot of the problems and things that come up with in-person advocacy participation. And I think it's a really interesting and exciting experience and opportunity.
So which states have meetings on the horizon that patients can get involved in?
Yeah, so we'll start with the PDAB issue because we were just talking about that. So states that have already passed legislation regarding PDABs and are now currently soliciting stories from patients, there are 3 of them. So Colorado, they started their listening sessions last year, and as of January 24th, started to open up surveys for more responses. Today is the last day that the surveys for Enbrel and Genvoya are open, but they're going to later in the spring open up surveys for Stelara and a couple other medications. We will, of course, send out notices to everyone, all the patients in our networks. So if this is an issue that you are interested in, I highly recommend you sign up for the 50-state network, Creaky Joints, the patient support programs, basically everything. Just sign up for them all to make sure that you get your notice. So Colorado is the one that is the furthest along. Oregon is another state that they have a virtual meeting in February, so next month. We will be participating. We encourage anyone who lives in Oregon to reach out, and if you're interested in sharing your story on a certain medications, we can share which medications they're looking at. And if you're able to share your story, it's very simple to do so, and we'll help you do that. And finally, Maryland is the other state that has already passed legislation and is now starting the implementation phase and starting to solicit patient stories. So if you're in Colorado, Maryland, or Oregon, and you are interested in kind of talking to a prescription drug affordability board, keep this in mind, and there might be an opportunity for you to do so. Additionally, there are a couple states that are looking at passing legislation that would allow them to do their own version of a prescription drug affordability board. So these are states that they aren't looking for patient stories yet, but they very likely will be. So that's Illinois, Michigan, Virginia, Connecticut, and Arizona. So these 5 states are in the process of passing their own version of legislation and looking at what the impact of prescription drugs have on their health system, and eventually, very soon, will likely be soliciting their own version of patient stories as well. So if you live in those 5 states or the previous 3, and you are interested in sharing your own experience taking certain medications or curious what medications they're looking at, please reach out to us at our advocacy team, the 50-state network, and we really would love to find ways to work with you on these issues and get your story and your experience out there.
Absolutely. You could always email us at advocacy@ghlf.org, and one of us will get back to you.
Yeah, for sure. And now finally moving on to the big project, the major policy that we are seeing across the country, copay accumulator adjusters. This is our bread and butter. This is the thing we have talked about for years and worked on for years, had a lot of success at the states, and now we're hoping to have some more. So the list of states that have current active legislation. So if you live in one of these states have bills that you can support right now. California, Massachusetts, Florida, Michigan, Missouri, New Hampshire, Ohio, Oregon, Rhode Island, Vermont, Wisconsin.
Wow.
And just for all my Howard Dean fans out there, woo!
Woo!
So all of these states currently have bills that have numbers. Some of them are, and we'll get into this in a little bit, some of them have hearings already scheduled. And there are also a number of states that have advocacy days already scheduled. So if you live in any of these states, there's 11 states there. And again, going back to something that Zoe briefly mentioned, even if you haven't experienced a copay accumulator, even if you haven't experienced step therapy, your voice still matters. If you live in these states, you are a constituent. These legislators are literally paid by you to listen to you. It is their job to listen to you. So if you live in these states and you care about these issues, whether you've experienced them or not, you still have a valuable point of view. You still can walk into an office and share your experience having your condition, having your disease. I personally, thankfully, have never experienced a copay accumulator adjuster, but I can still talk about the burden of disease as a type 1 diabetes patient. I can still let legislators know if I did go through a copay accumulator adjuster, this is how it would affect me, and this is how it would affect my entire life. And that point of view is very valuable. So while you're listening to this episode, if you're thinking to yourself, that issue hasn't affected me, it hasn't affected a loved one, maybe sometime in the future, I want you to just keep in mind, it doesn't need to. Your voice is still important. Your voice still matters. So if you want to get involved in these states for these issues, please do. And we can help you connect you to the right people. So please reach out to that advocacy@ghlf.org email, and we will make sure that we put you in touch with the right people. So from the standpoint of advocacy days, there's a couple in February and March and one in April, specifically related to copay accumulator adjusters. So if you want to join any of these, just let us know and we'll help put you in front of the right people. So those advocacy days, just so we can kind of list them, and I'll stop talking afterwards and let Zoe ask her question because I realize I've been going on a bit of a rant. But on February 6th, Missouri in the state capitol is holding an advocacy day. February 8th, the National Multiple Sclerosis Society is holding an advocacy day in Florida. On February 12th, the Bleeding Disorders Organization is holding a Capital Day in Oregon, in Salem. On February 29th and on March 18th, there are a couple different organizations holding advocacy days in Sacramento, California. So if you are able to make one of those two, please let us know. We will put you in touch with the right people. And finally, on April 9th, Columbus, Ohio, they're having an advocacy day. All of these are related to copay accumulator adjusters. So they want to get as many patients there as possible. Again, you don't need to have gone through an accumulator adjuster. You don't need to have had any issue accessing or affording your medication. You don't even really need to have a condition or a disease. You can just show up. You're a constituent. Your voice matters. If this is something that matters to you or the people you love, and you're able to do it, please do.
Awesome.
So I'll take a break from there.
By the way, never apologize for going on and on. That's what earned you a spot as unofficial official co-host.
Well, I'm glad to hear it. And I'm always happy to come by and get a little ranting in.
So we talked a lot about the states. Should we move to some federal advocacy?
Yeah, I'm happy to do that. So the federal advocacy isn't as exciting from the state side in a lot of ways because federal advocacy, admittedly, takes quite a bit longer. Things move a lot slower federally because things are a lot larger. The size of the federal government versus the size of state governments mean that things take a lot longer. You need a lot more people to agree on things. And so things we've been talking about for years are still major issues. So Safe Step Act is the federal version of the step therapy law. Now, what's exciting is that this year we really do seem like there is momentum to get this bill passed into law. Pharmacy benefit managers are a major point of emphasis in the current setup of Congress. So there's a big effort to get a reform package passed for PBMs at the federal level. There is real momentum to include the Safe Step Act in this final language for the PBM reform law. So groups like GHLF and many other patient groups around the country have been working very hard in the beginning of this year to ensure that it remains in the final language for the bill. There is a lot that can happen between now and the bill's final passage. We at first thought we were going to have to do it this month, but there's some budget things that happen. So now we have a little bit extra time to pass this. So we have basically until March 1st and March 8th to keep pushing support for this law and ensure that as the final PBM reform bill language is completed and finalized, the Safe Step Act is not cut from that language as a result of making it a smaller, more easily passable bill. This is something that has bipartisan support in both chambers and shouldn't be difficult and shouldn't be one of the things that's cut just to make the bill smaller. So that's what's on us to really work and make sure that that happens, that we are going to be participating in a Federal Hill Day on March 5th with the Digestive Disease National Coalition, where we will be supporting this as well as the HELP Copays Act, which is the federal version of the copay accumulator adjuster law. And we will also be participating in another one in April with the Alliance for Transparent and Affordable Prescriptions. So if you want to get active on federal legislation as well, specifically, by the way, if you have a digestive disease, there is an opportunity for you to participate in the DDNC's Federal Advocacy Spring Policy Forum as well. So if you are interested in doing some advocacy work in DC in March, and would like to get involved that way, again, please reach out to our advocacy email. We will connect you to the right people. We will make sure that you are able to share your voice at the federal level as well as the state level. And finally, the last kind of federal update is with regards to the HELP Copays Act. So again, something we've talked about a couple of times, federal version of a copay accumulator adjuster law, something that isn't as far along as the Safe Step Act, in part because it was introduced a few years later. So it's just a little bit behind, but we are hopeful about this as well, continuing to garner support and get a little bit closer to a potential passage. And that's really it at the federal side. There are opportunities from a non-legislation standpoint to share your experience with CMS during their drug price negotiation hearings. They're continuing to try and solicit information from patients similar to the way that the PDABs are doing at the state level. If you are interested in sharing your experience with the federal government, again, just keep an eye out for our emails. We will make sure that we will send out information about surveys, about opportunities for advocacy, about listening sessions. The best way you can get all of this information is to sign up for the 50 State Network and let us know what things you are interested in so we can then make sure you are aware of them. And I think that's everything from the advocacy update, unless you have any questions or want to dive into anything specifically.
No, that's a lot. And it's really exciting that so much is coming up in 2024. I would just say, if you're listening to this and you feel like any sense of overwhelm by how much there is, know that there's many different ways to get involved. You can, like Corey mentioned, go talk to your legislators. We can also share your story on social media or in the 50 State Network newsletter. Advocacy is really what you make of it and what you want it to be. And I always say, there's no act of advocacy that's too small. You talked about the momentum around the Safe Step Act, and I think that we've gotten there because every year there's a little bit more people sharing their stories and putting more pressure. So whatever way you want to get involved and share your story, we're here to help.
Couldn't agree more. Everyone has a valuable experience to share. Everyone's individual disease journey is important. Whether you've gone through these policy or these issues in the past or not, the average person in America doesn't know what it's like to live with your condition. So if you can simply just share with legislators what it's like to live every day with a chronic disease, that has value.
Awesome. Well, thank you so much, Corey. I learned a ton from you today on where we're getting active and how we can get involved. So thanks so much for co-hosting with me, and we'll have to have you back on to give updates as the year goes on.
Yeah, I can't wait. I'm always happy to join you, Zoe, and always happy to step in for Stephen when it's necessary. And yeah, if anyone is interested in learning more about any of these advocacy opportunities or ways to get involved, I'm always available. I know our advocacy team is always available, and we're excited to see what 2024 has in store for us.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, please give us a rating, write a review on Apple Podcasts, and hit that subscribe button wherever you listen. It'll help more people like you find us. I'm Zoe Rothblatt.
And I'm Corey Greenblatt. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.